FUT versus FUE. What are the differences? I think when it comes to choosing whether FUT or FUE, the outcome is the same. It's just that FUT is the one that we take a strip off from back of your donor area, and it will just leave long linear scar after the surgery. However, FUE, follicular unit extraction, does not leave any scars after the surgery. Also, another difference is that when we do FUE, the extractor has more option and ability to pick and choose which follicles that you can use. Meaning, if you are doing crown hair transplant, you need more multiple follicles to create more density. When we do FUE, we can pick more follicles that has more follicles attached to it versus singular follicles that usually used for the for the hairline surgery.
So what are the considerations that the consumer should make regarding the FUT transplant versus the FUE? Again, let's define so we understand. FUT stands for follicular unit transplant. FUE stands for follicular unit extraction. The difference, again, is the FUT requires an incision in the back of the scalp, a removal of actually a part of the scalp, and then closure with stitches of the site, where the technicians then will work on the side table, extracting those individual follicles from that piece of scalp that's there. The FUE requires no incision whatsoever. There's a micro little punch that's used to extract individual follicles in a sparse pattern. In other words, we extract them from various areas to keep the donor site looking full and not creating a bald spot, if you will. So really the surgeon should tell you which technique is best for you. This is not a decision that the consumer should make. The consumer does not know enough as to which technique is best for them. However, a couple of the highlights are, if you're a woman, then you may not want a shave spot in the back. The shaving is required for the FUE. For the FUT, shaving is not required, so the woman can have a simple comb over even of that piece of scalp that was removed, and that would be a consideration in a woman. However, our gold standard, and pretty much nationally and even internationally, the gold standard is there's so many more FUEs done because of the lack of a scar in the back. Recovery time is much faster, there's less bleeding, and the pick and choosing of the sites that Dr. Nam mentioned before. We have so much more variability to pick, for example, a single follicle from a large group like a forest of follicles, and then a triple hair shaft. If you have that one scalp strip, you only can choose what's on that scalp. You don't have the entire head to choose the variability. So Dr. Nam, our viewers may want to know, is there a difference in the success rate between the FUT and the FUE? Let's just say that the scar doesn't matter to a particular person.
Right.
And they really want to know, which way am I going to get the best result? Is there a difference in our opinion?
I think when it comes to the rate of success, whether FUT or FUE, it shouldn't really matter. And as a matter of fact, it doesn't really matter. But I think the main difference is that if you need to have more than one surgery in future, meaning if you are a younger patient, FUT is the way to go to reserve more donor for future surgery. I think that's the only consideration that patients should think about when deciding between FUT versus FUE. How do surgeons decide whether FUE or FUT is better for the patient? I think it all comes down to the patient's, the donor availability, meaning if patient only has a limited number of the donor and he or she may need one or two more surgeries in future, I think FUT is way to go to reserve more donor availability for future cases. However, if patient has enough donor for future cases, I think FUE is way to go because it's much less invasive for the patient for the recovery purpose.